I think some treatment centers hire people to manage their marketing and their outreach as almost like a sales job, which sounds a little icky when you're in healthcare. But I mean, the reality is, we are a business and we need to generate revenue, and ideally we generate more revenue than we spend in cost. But I will tell you that, the beauty of selling quote unquote SunCloud is that it doesn't feel like selling. There tends to be kind of this sense that when you're selling something, you're in some way or another creating value or creating the perception of value where maybe there's not as much value, sometimes where there is no value, or very little value, rather. There's always value in something. And the beauty of what we do here is that I think that we really believe, I know that we really believe in what we're doing. We have a very strong leadership team, starting with Dr. Dennis and down. We invest a ton of time and money in our staff and the resources that we need to provide the right quality of care for the right patients. And we focus obsessively not only on service and quality, but on doing everything we can at the front end and through treatment to focus on helping people that we actually think we can help. And for those who are in this field, they know exactly what I'm referring to. And for those that are not in this field, let me just put it this way. There's a lot of gray area. There's very little transparency into what goes on behind the doors of all of us treatment centers. There's, as I write a lot about, very little attention focused on any sort of standardized quality measurements. So at the end of the day, if your goal is just to make money, you can admit anybody, and that can be done, let alone whether or not you think you can help them. At SunCloud, we've never done that. In fact, we do the opposite. We admit less than 50% of the people that do an assessment with us. And the reason is we are really, like I said, obsessively focused on doing what we do best. And what we don't do best, or what doesn't fit us, we refer to one of dozens of other facilities all within a couple miles of our location. And it's a source of pride for us, not because we don't want to help everybody who comes through these doors, because we do. If we had our druthers, we'd help every single person that not only came through our doors, but who called us, because everybody who does that deserves help. But we don't do everything. We don't specialize in everything. We know there are some things that we're really good at, and there are some things that others are better at. And we think we have a pretty good handle on some of that data and some of those facts. And so we really do, when we say we think we can help somebody, we really mean it. Doesn't mean we're right. It doesn't guarantee any sort of outcome, let alone a positive outcome. But one of the things that I tell people when they ask, tell me about your, what are your success rates? And I mean, we'll answer all those questions with whatever data we have. But the one thing I can promise, and that I do tell people they can count on, is that if we say we think we can help you, we really mean it. And if we say we don't think we can help you, it's not because we don't want to. It's because we know that you deserve the best care that you can get. And if there's somebody else who can do it better, we absolutely want you to get that care. That's something that we're really proud of here at SunCloud. And I think that, something that whoever is out there representing us in the field, should take a lot of pride in as well.